Hello, everybody, and thank you for joining my presentation on embedding equity into the writing of research questions using administrative data. So my practicum took place at the Manitoba Centre for Health Policy under the supervision of Dr. Amy Fryer. MCHP and my home are both located on Treaty 1 territory, which is the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and is on the homeland of the Métis Nation. Administrative data is information collected by government or private sector organizations as part of their ongoing operations. The Manitoba Centre for Health Policy is home to the largest data repository in Canada and one of the largest repositories in the world. The data repository is a collection of administrative databases across sectors. The Manitoba repository has data from healthcare, social services, registries, the justice system, and education. Researchers can access de-identified data from across all 5 sectors that are linked on an individual level. This allows for powerful and robust population health research. However, several systems collecting data, including the social system, justice system, and healthcare system, stem from oppressive institutions that result in an inherent bias in the data collected. It also should be noted that this data is often collected at extremely vulnerable points in people's lives. In that sense, individuals are often represented in the data by their lowest points without any representation in the data by their highest points. Unfortunately, the history of administrative data research is not pretty. Administrative data has been used to elevate one group of people over the other as being inherently better based on culture or race. These data have been used repeatedly throughout history by white supremacists to promote their political eugenic agenda. There has also been significant power imbalances that have existed between researchers and the communities they study. Researchers decide who and what to study and have historically acted as the gatekeepers of knowledge. While the data is de-identified at an individual level, it is not de-identified at a community level. Contrary, research using administrative data is often used to describe communities experiencing marginalization. While this identification of inequities is important, the constant description of communities with poor health outcomes can be alienating. In fact, qualitative work with the Maori people in New Zealand highlighted this personal connection people feel with the data, stating, "Keep in mind that people often think of information they have supplied or that is about them as personal, even when it has been de-identified or anonymized and is being used in a non-personal form." Because of these concerns, it is important that an equity lens be used when performing research with administrative data. The most impactful research program designs place an equity lens at the forefront when writing the research questions. The goal of my practicum was to create an equity in research questions tool to be used by researchers at MCHP to help center their projects in equity and avoid alienating populations or perpetuating historic research harms. Using an equity lens is difficult, and it's easy to forget when wrapped up in the details of day-to-day work in research. The goal of creating this tool was to give researchers an opportunity to pause, reflect on their work, and be reflexive in response to many power imbalances that exist. Through an integrative literature search of publications, other equity toolkits, and community-driven calls for equity, I landed on 3 main recurring themes for the tool that researchers at the center should consider when writing their research questions: positionality and assumptions, project framing and language, and the consideration of potential outcomes. Positionality was described really well by Stephanie Nixon and her coins of privilege. Your positionality is the intersection that you occupy based on the various factors of privilege, such as race, gender, poverty level, sexual orientation, to name a few. These represent various power structures. Researchers have an inherent historical power over the communities that they study. And this is exacerbated when their personal positionality is far removed from the community. Efforts to balance the power structures include participatory and collaborative research. The positionality of the researcher can cause them to make assumptions about the communities they are studying. Assumptions can include the classification of something as a problem, an assumption about what is determined to be a positive health outcome, and what indicators are used to measure the outcome. This tool helps researchers address their positionality and assumptions and be reflexive to become more equitable. Researchers using administrative data and studying communities experiencing marginalization are encouraged to use a solution-oriented approach rather than a problem-oriented approach as much as possible. This often results in better impacts on the community and drives progress forward. For example, instead of further characterizing poor outcomes associated with aging populations moving to long-term care homes at increasing rates or problem-focused, in Manitoba, we piloted and are studying outcomes associated with the Aging in Place program that provides services to help people stay in their homes for longer. It is also important to recognize the source of inequities. Our language often follows the biomedical model of health when dealing with social determinants. So we say that race is associated with poor outcomes. Rather, we should focus on language within the social model of health, where poor outcomes are associated with systemic racism. An example is the inappropriate attribution of increased risk of contracting COVID-19 based on race. In fact, there's nothing about a person's race that makes them more likely to become infected. Instead, it is the systemic oppression that disproportionately places racialized people in housing and employment positions that greatly increases their exposure to the virus. The literature highlighting the voices of communities experiencing marginalization repeatedly reiterated the importance of understanding the possible outcomes of a research question from the start. If performing a descriptive study, it's important to clearly articulate why a researcher is describing these populations and what they plan to do with the results. Will the characterization of populations experiencing marginalization change any interventions or actions? If not, there may not be any benefit. If populations have been characterized before elsewhere, further characterization may not be necessary and may instead form a more solution-oriented study rather than continuing a problem characterizing approach. If performing an analytic study, examining interventions or other policy changes, it is important that researchers map out what they may conclude if they find a positive, negative, or no correlation, and how each of these results may impact the community. If the possible outcomes will not result in any actual change, then the study may not be worth doing and may actually be deemed harmful. If the results could inform program planning or policy, reaching out to decision makers at the start of the project may improve that subsequent meaningful change actually occurs. There's often plenty of evidence informing a particular action. However, if the evidence thus far has not been successful, adding yet another study may not have any positive impact, and another avenue of advocacy should maybe be considered. The logistical and most equitable answer to each of these questions is to form a meaningful and fully engaged partnership with community members. Members of communities, particularly those experiencing marginalization, are experts through their lived and living experiences. They have personal knowledge of barriers, aspects of oppression, and often an important cultural lens. Making space and fully valuing this expertise shifts the focus of the research on the goals of the community. The Equity in Research Questions tool is meant to be a companion piece as part of a larger institutional and cultural shift towards more equitable approaches to research with administrative data. I will end this talk with a slide containing several really great resources that researchers can use to help orient their work using an equity lens. Thank you for your time, and I will now answer any questions.